Hello, I'm Dr. Claire Jones, and I'm one of the physicians here at Mount Sinai Fertility. I'm going to tell you about egg freezing. An increasing number of people are exploring the option of egg freezing. The number of people freezing eggs for a medical condition such as cancer has doubled in the past 5 years, whereas those freezing eggs for non medical reasons has been increasing by about 40% every year. This is due to a number of factors. First, the technology for freezing eggs has improved considerably in recent years, allowing for improved outcomes. Also, people are becoming aware of this potential opportunity to have a family at a later date, despite declining fertility or a medical condition that affects fertility. Whatever your reasons are for considering egg freezing, this video will provide you with some background about the process, the risks, and the likelihood of conceiving a child using frozen eggs so that you can make an informed decision. Egg freezing involves retrieving the eggs from your ovaries, assessing them, and selecting the mature ones to be frozen using a technique called vitrification. Your frozen eggs will be stored until you are ready to use them. Using vitrification, we expect approximately 85% of the eggs to survive being thawed. Mount Sinai Fertility has been freezing eggs since 2013 and has gained considerable data and experience on its survival rates. The goal of an egg freezing cycle is to safely stimulate your ovaries to develop around 10 to 15 mature eggs, rather than the usual 1 mature egg each month. The more eggs you have to freeze, the more likely you are to develop an embryo leading to a pregnancy. While we can predict the number of eggs you are likely to achieve during an egg freezing cycle, there is no good test to predict egg quality. Age at the time of egg retrieval is the best indicator, as age affects both egg quantity and egg quality. Ideally, we prefer our patients to freeze eggs before the age of 35, but will freeze up to age 38. Regardless, we will talk with you about your likelihood of achieving a pregnancy and we'll discuss your options. Let's have a look at the overall process, which takes 4 to 6 weeks and involves 4 main stages: priming, ovarian stimulation, egg retrieval, and vitrification. Typically, priming takes place during the first 2 to 3 weeks of your cycle and commences with the start of your period. During this phase, you will take daily oral medication to prepare your ovaries for stimulation. Priming facilitates gradual and coordinated growth of your follicles. Ovarian stimulation occurs over the next 2 weeks. During this stage, you will take 1 to 3 daily hormone injections to enhance the growth of the follicles produced in the ovaries. You will also take an injection to prevent ovulation. During this time, you may experience side effects such as headaches, mood changes, breast tenderness, upset stomach, bloating, and cramping. You will make frequent morning visits to the clinic so we can monitor the progress. Once the follicles grow to the appropriate size and number, you will be instructed to take one final injection called a trigger to help the eggs mature. The timing of this injection is critical, and you will need to follow your care team's instructions closely. During the stimulation phase, there is a possibility that your cycle will be cancelled if we do not see enough follicles growing. This decision will be made in consultation with you. Once your follicles are ready, we prep for the next stage, egg retrieval. On the night before the retrieval, you will not be able to eat past midnight until your procedure is complete. However, you can drink clear fluids up to 6 a.m. the day of the procedure. You will be instructed to arrive 2 hours before your egg retrieval procedure. The nurse will insert an IV to provide you with hydration and pain relief during the retrieval. Everyone's pain tolerance varies, and although you will be sedated, you will not be asleep and may experience some discomfort or pain. Once ready, the physician uses a special needle connected to an internal ultrasound probe. This device passes through the vagina and into each ovary to retrieve the eggs. The follicles are drained and the fluid is sent to the lab. Embryologists then examine the fluid samples to find the eggs. We will need to thoroughly examine each egg before we can determine how many mature eggs are available to freeze. After retrieval is complete, your mature eggs will be frozen immediately using vitrification technology. After the procedure, you will need someone to accompany you home. You should rest for the remainder of the day as your memory and judgment may be affected by the sedation medication. Some potential risks of the procedure include discomfort, bleeding, infection, internal injury, or complications of sedation. Your care team will review all potential risks in detail with you prior to starting your cycle. Once your egg freezing cycle is complete, your physician will meet with you to review and determine whether additional cycles are recommended or possible. To increase your likelihood of achieving a live birth later on, our goal is to freeze between 15 to 20 mature eggs in those aged 37 or younger, and to freeze between 25 and 30 eggs in those over 37. It is important to consider the possibility that you may require more than one egg freezing cycle to generate the number of mature eggs recommended. What happens when you are ready to use your eggs? As long as you are medically well, embryo transfer and pregnancy can occur up to age 55, although pregnancy is recommended before age 45 due to higher rates of pregnancy complications. Once thawed, the eggs that survived will be injected with sperm through a process called ICSI. Roughly 80% of the eggs will be successfully fertilized this way. You can learn more about ICSI and IVF by visiting our website. After thawing and fertilization, your fertilized eggs are incubated for 3 to 5 days. If an embryo grows, embryo transfer will occur. During this procedure, the physician places the embryo into your uterus. As with any procedure, there are certain chances for success and risks involved. Even if the process goes smoothly, there is no guarantee of viable eggs or embryos to transfer, nor is pregnancy guaranteed. Currently, the chances for pregnancy per egg is about 6.4%, and the pregnancy rates per cycle are 25% on average, but can range from greater than 60% to less than 5%, depending on how old you are when your eggs were frozen and the number of eggs frozen. It is also important to be aware that there are associated risks with pregnancy by IVF and ICSI. They include a slightly increased chance for birth defects. You may have a higher risk for high blood pressure during pregnancy, premature delivery, C-section delivery, and low birth weight. Any pregnancy can result in ectopic pregnancy and miscarriage, including a pregnancy achieved through fertility treatment. You should consider that pregnancy at a later age also carries increased risk for the conditions just mentioned, in addition to diabetes in pregnancy and stillbirth. Some individuals decide that pregnancy is not right for them and consider possible donation options or to discard their eggs. Your options will be reviewed with you. There is also a chance that you will not need to use your frozen eggs because you achieve a pregnancy without intervention. Patients should also consider the overall costs of freezing eggs and using them to get pregnant through IVF in the future. A single egg freezing cycle can cost between $10,000 and $15,000 when including the costs of fertility medications. Consider that you may need more than one cycle to generate the recommended number of mature eggs, and that there will be annual egg storage fees. There are costs related to thawing and using your eggs in the future. We would be happy to review with you the financial aspects of egg freezing in advance. Should you decide that egg freezing is not for you, other options may include attempting to become pregnant now, using IVF in the future, using donor eggs, choosing adoption, or deciding not to become a parent. If after watching this video you would like to learn more about egg freezing, we would be pleased to arrange a consultation with one of our fertility specialists. After this initial consultation, you will be asked to perform a number of blood tests and ultrasounds. One of these blood tests is called anti-Müllerian hormone, or AMH. While this test cannot predict egg quality or your ability to become pregnant, it can predict the number of eggs obtained at the time of egg retrieval. Your physician will review these results with you, and together you can come up with a plan going forward, weighing the risks, the benefits, and the likelihood of success. If egg freezing sounds right for you, the care team at Mount Sinai Fertility will be pleased to help you through the process.